Hi, this is Steve Anderson, pharmacist at the Apothecary. We're going to talk a little bit here about our symptomology sheets. We work a lot with patients with their bioidentical hormone replacement therapies and also those with the prescriptions for low-dose naltrexone. So both of these are circumstances where the communication and progression of the condition is very important to understand as you're trying to find the best dose for the individual person. We have a symptom sheet for each condition, one for the bioidentical hormone replacement and one for the low-dose naltrexone. And both of them we're finding very important that we utilize as a tool to help understand the symptoms as we're moving forward and progressing to a better state of health in either condition. So for the hormone symptom sheet here, you'll note on the left-hand column that some of the symptoms are separated out into the different hormones, columns under estrogen, progesterone, and testosterone. Those would be the symptoms that are more likely associated with those hormones versus one of the others. That being said, all the hormones do have effect on all the symptoms in the body. Just if you had to choose sleep, for instance, that's predominantly a progesterone issue, but the other hormones could affect it as well. Hot flashes, we have listed under estrogen. That's predominantly due to the estrogen deficiency, but progesterone helps that as well. But there's a couple blank spots for any specific conditions or symptoms that are specific for the individual person. The bottom column mentions dose of progesterone and dose of estrogen. That'll be utilized to determine what your best dose is too, because we'll know what dose you're on and what symptoms you're experiencing still. And we have listed on here on a scale of 0 being not an issue to 3 being that's very troublesome symptom for you. So on the low-dose naltrexone symptom sheet, there's a bigger range of symptoms that we're following. And again, we left some open blanks on the bottom. If there's some symptom that's troublesome for you, track that one as well. What we ask is when you first start on it for a baseline, just write baseline on the top. And then as we progress forward on your dosing and try to find the right dose for you, we'll always be looking at the initial symptom and determine, how the progress is going. Our goal is if you're still having some symptoms that you would like to see improve, that just means we have to tweak the dose. The communication with us and yourself and the practitioner is of utmost importance as we all work together to try to find the dosage that works best for you and gives you the best results. Please don't hesitate to call if you ever have any questions here at the Apothecary.